What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering X-ray student clinicals in the emergency room, what to expect. So to give you context, I'm an X-ray tech, been doing it for 4 years, work typically night shift, 7 on, 7 off, but I dabble in a lot of day shifts. So I remember both me, when I was a student, both even now, observing students, and I can have a pretty well idea, since where I work at has students, of what a typical ER day from someone on the other side looks like. So I would say typically at our establishment, the students usually stagger in. We used to not stagger in. You could kind of pick and choose, but now I guess because of staffing and because of maybe confrontation, or I guess maybe just having enough people, we just kind of staggered the students. So like one will get in at 7, the other one 7:30, the other one 8. So they'll kind of stagger in. So maybe there's like a little window where they're semi by themselves. So, if they need to check off something or have questions, they can do like, being by themselves and just the text. So in the emergency room, typically at that time, you're still, if you come in, like the first 2 people who come in are still with the night shift tech. Us as night shift, we leave at 8 o'clock, 8 a.m. That's when the shift change happens in the emergency room. So you will get to work a little bit with the night techs. So typically you come in, they check in their little like iPad or Amazon Kindle. They'll check in and then they'll kind of see, are the techs doing anything? No? Okay, let me go back and see if I got to restock anything, the linens and stuff like that. Maybe look at the machines and see if everything's okay, just to kind of get a heads up. Maybe see, do we have anything? Or is there anything happening in the main? Even if there's stuff happening in the main radiology, let's say if you're in a fluoro clinical site, so like enemas or small bowels or other stuff like that, and you need them, and there's not a student up there, or the student who's up there doesn't need it, most techs will usually check up on that, and they'll be like, hey, they're doing an enema, do you need it? Because, like contrast exams are few less. Certain ones rarely happen, other ones happen occasionally. Also, depending on what day of the week is, certain stuff happens more than others. So that's kind of something that maybe even if you're in the emergency room, you still can dabble in the other departments. Same thing with the patient outbuilding. We have, even if you're in the emergency room, let's say a skull, mandible, whatever spawns in over there at the other place, and maybe the student there didn't need it and you need it, sometimes the techs and other stuff will communicate and you're able to, jump in and get your comps and stuff like that. But anyways, going back to just the emergency room, typically the 7 to 8 o'clock is kind of where it starts picking up in the morning. Anything before that, it's kind of pretty dead down. Being a night tech, I kind of know. So that's kind of a good time to come in. If you have any questions about what you can expect or like what's to come, because certain days you have certain doctors who are in the emergency room, so you can kind of know, hey, we have so-and-so doctor. We're probably going to get busy if we have a lot of people. Or, hey, we have so-and-so doctors. It's probably going to be a chill day. Like, you can kind of already seize it based off of that. So, usually we spend half of our time in the emergency room shooting what we do. If your emergency room place is big enough and it's an actual hospital, you have the floors. Ours has divided the west side and the east side. Typically, if you work in the emergency room, the techs there are also responsible for whatever happens on the floors and the emergency room, because the other 2 main departments, one is the main, which handles all the fluoro, the other one's the outpatient building, the people who randomly come in. And so the emergency room kind of dabbles in the rest. So you could either be with a tech all day in the emergency room shooting mostly chest x-rays, but like there, and then both portable or the main x-rays, and then the rest of the time you could be spent going to the floor shooting stats. Usually on the floors we have a lot of chest x-rays. Sometimes they order KUBs and G tubes, which is just typically an upper KUB, and then sometimes we have full KUBs, because like we'll have one of the most common things like ileus or some constipation, or their tummy hurts, or whatever stuff be happening to the patients. Usually that's about it. Sometimes you'll have post-op X-rays, like post-op hip, post-op foot. Sometimes you'll have it's mainly for like towards the later afternoon when the surgery X-ray techs are gone. You may have to go into what is called the PACU, so post something procedure or whatever. So essentially patients either heading to the procedure or coming out of the procedure. Sometimes they don't call in the surgical tech to come shoot just a basic hip or something. So sometimes we'll go over there. Or sometimes you go to before they go to the cath lab, we'll shoot some stuff over there. That's stuff that's kind of done. Usually you'll kind of do that all day. And then more closer to the after, like once you get closer to it's time to leave, typically the students stay in the ER, hold it down till they have to leave. So I would say if you're in the emergency room, that's kind of what you can expect. Halfway in between, you'll get your little. With our school, it's a 30-minute lunch. I'm not sure how other schools do it, but ours is 30 minutes. The techs, on the other hand, speaking both myself, you don't always get lunch. Lunch is if you eat when you can type situation. And sometimes you don't get your full 30 minutes. So it just is what it is. But you'll kind of do that. And then sometimes you'll have other students who will come into the emergency room later on. Our trauma rotation in the emergency room is from like 2 to 10:30, which isn't a true trauma rotation because typically me working the night shift, you don't all the good quote unquote traumas doesn't happen until probably 2 a.m. or even midnight. You'll have the quote unquote good traumas. So most students don't get to see much, or like 11 o'clock. So typically they miss out a lot of the times. But that's kind of how the emergency room kind of rolls. I mean, you'll have some techs that will leave at 4:30, other ones that leave at 8 o'clock, and then other departments. So like you'll work with different techs depending, because like certain techs work staggered. So sometimes you may work for a few days with some techs. Other times they'll like rotate around the hospital depending on what they got to do. And yes, Benny, where we go. See you on the next one.